Hey everybody, welcome back to Health Matters. This is brought to you by Cipla, and of course today's episode brought to you by CertMune. My name is Ryan O'Connor. Now the COVID-19 pandemic, I know when you think of that, you think, postscript in our collective lived experiences. Well, for most of that part, it's an experience we can mostly continue and rather have continue in the history books. But for a lot of people, long COVID has lingered long after the multiple waves of infection. From fatigue to shortness of breath, cognitive issues, the list is on, and it's a complex and challenging condition. It's also difficult to get an accurate picture of its impact due to its elusive nature, but multiple reports, studies, and conversations, and through them we've had with friends and family, we can also make it clear that a significant number of individuals experience lingering symptoms. To tell us more and help us unravel the mystery is Dr. Adrian Wentzel. He's been on Health Matters before, specialist anesthesiologist at St. George's Hospital and Medical Forum Theatres in Port Elizabeth, South Africa. Dr. Wentzel, hello.
Thanks for the invite, Ryan. It's been a long time.
Thank you. It has been. Now, listen, following the COVID-19 pandemic, has there been an increase in patients showing negative effects on their cognitive health?
Absolutely. Most of the patients are showing cognitive deficits as well as the rest of their symptoms. As you know, the long COVID is quite a complex array of symptoms following an infection. It's not really related to the severity of the initial infection, but what we know is it seems to be selecting for and being directing itself to people with pre-existing conditions. Many of these are NAD-related conditions and are associated with low NAD. As you know, it affects many of the organ systems. And today we had to talk about the cognitive function, but always remembering that the brain, the autonomic nervous system, respiratory, cardiac, kidneys, lungs, basically all the organ systems, especially the immune system, the inflammatory system, and endocrines are all involved. So it's super complex. And as you know, it presents with a very quick picture, right the way from excess exercise intolerance all the way to emotional and mood problems, as well as cognitive problems, as we are talking about today.
How can the average person recognize whether the effects of long COVID may have affected their cognitive health?
Well, I think that really to understand that, you really have to look at what the brain health as a whole, really. Made up of brain health, we're looking at cognitive function. How well do you think? How well do you learn? How well do you remember? Then there's the motor function. How well do we move? Is our movement controlled? Emotional function, which also comes into it. How well do we respond to emotional input, and is it appropriate? As well as the tactile function. We see patients that present with these tactile problems, pressure, pain, vibration, and temperature, all affected by long COVID. So really, from a patient point of view, when you understand that, looking at just the cognitive side, we start to notice that patients start to get confused with time and place, and they start losing things. They get confused with dates. They're missing appointments. They have trouble finding the correct word for the situation, forgetting important events. And then also trouble with visual imagery and spatial tasks. And I think really the most important thing, Ryan, is with these symptoms that the patient presents is that they actually need to be quantified. Quantifying them allows us to decide whether they're getting better or worse. And also, when one quantifies them, one is able to look at all the other risk factors. And how this normally happens is the patient will present to the general practitioner. They do a mini mental state examination, which is a very easy thing to do. And that gives us, it looks at things like orientation, immediate recall, attention and calculation ability, and then long-term recall and language proficiency. From that, not only does the GP look at that specific mini mental state examination, but also they are interested in things that aren't necessarily just long COVID, things that present, and they need to be excluded before we even look at long COVID. We need to be looking at nutritional deficiencies, severe anxiety that impacts on cognitive function, stroke, traumatic brain injury, things like multi-infarct, dementia, vascular disease, cholesterol, sugar that's out of control, and things like alcohol consumption, as well as varying forms of addiction. And once we've done that, then really we have a complete indication of where we stand from a cognitive perspective, because not only have we identified the cognitive and quantified it, but we're also looking at the risk factors, which allows us then to be more specific in managing the cognitive impairment.
Could you share, Doc, some insights on the different types of NAD plus the supplements available, and how do they differ?
Okay, well, it's super complicated. So I think the most important thing here is just to recap a little bit on the NAD and the related metabolites. So NAD is really, as we know, important for all of our biological functions: metabolism, energy creation, redox homeostasis, mitochondrial function, circadian rhythms, and immune balance. And once we understand that, we realize that NAD needs to be created perpetually, and there's this flux of NAD in the body. So at any one time, it's being created from some kind of a supplement or nutritional base. It's also being consumed and utilized by things that manage the immune response. It's consumed by things that repair DNA as well. So things like sirtuins, as well as POPs, big names, but all they're doing is they're managing function and repairing DNA. It's also being broken down. It's utilized for about 400 different processes, and then what happens once it gets broken down? It's recycled. So there's a recycling of NAD from the breakdown of the NAD, and this basically brings us to the types of supplement that we can be giving. And from an oral point of view, and I think we should just they're attainable by the man in the street, and there really are two big groups. The first group is the group that makes use of the nutritional pathway that is basically giving you nicotinic acid, and this pathway basically comes into the de novo pathway. The de novo pathway is what causes a lot of trouble in long COVID. It basically steals tryptophan to make NAD if you don't have enough nicotinic acid. And so from a long COVID perspective, the nicotinic acid supplement is what we really are interested in. What it does is it basically enters into the price handler pathway, and what it then does is it makes NAD after two steps. So that is the one type of supplement coming into the normal nutritional pathway. The other part of the supplements are the ones that come in basically with product that is going to be salvaged. So really it would be the salvage pathway, the pathway used to reuse the initial components of NAD+. And those ones would be the nicotinamide riboside, and nicotinamide mononucleotide. Probably of less interest for myself, when you're looking at the nicotinic acid using the price handler pathway, we're also really interested in all the other effects that the nicotinic acids effect on vascular health, cardiac health, cholesterol, glucose control, and mitochondrial health. Yes, some of the ones that utilize the salvage pathway also have some of those benefits, but probably not as many as. So I think that's really the two groups one needs to choose which one of the groups one wants to utilize.
Absolutely. And then obviously that goes to the consumer, because now obviously from a consumer point of view, what do consumers need to know about the different types of NAD plus supplements that they're available? And I think that you touched on quite a bit of that now with that previous answer.
I think I think the consumer has the biggest task. There are many different products out there, and I think you have to be goal directed when you choose what you want to do. I think that's the first thing. The second thing is that, as we found with all the patients around the world, that the quality of the supplement is a major factor as far as whether it works or not. So in some places, I've had to use two or three different types of the same thing, because some worked and some didn't. So the quality of the supplement, and then just to be aware of these. A lot of people put in fillers to fill the tablet, and then you have to choose the best formulation to deliver what you want to get your best results. So you have to be quite goal orientated. Then I think the next thing you got to decide: are you going to go for a single NAD type of a supplement, or are you going to go for ones that have added benefit? Things that might modify the breakdown of their NAD or the utilization of the NAD. Things like quercetin and resveratrol, which in my opinion are important. Are you going to go for things like zinc added in, which is a very important commodity for sirtuin management? It's an NAD, zinc and NAD are the two things that manage your sirtuin so that it functions properly. Yeah. And then I think the last thing that I always have to warn against is this: more is not always better. And we always have to look at the fact that if you give large amounts, the body will resist the change. Okay. And I think that if you're giving the right amount to make appropriate changes in the nutritional status, that's what you're looking for. So more isn't better. It can lead to a lot of things like renal stones and problems in itself. So I think that's really the bottom line. And then the other thing is, when one is looking at nutrition supplements, one has to make sure one excludes, before anything else happens, diseases, comorbid diseases that the patient might have or may not have been diagnosed before you can call it long COVID. So you have to get rid of the things, set aside the things like thyroid disease, cardiovascular disease, heart disease, diabetes, all of those things that can, vitamin B12 deficiency, all of those things that can mimic long COVID. And that, when I deal with patients, is one of the most difficult parts, because often there is long COVID plus comorbidities. And it seems like the trick is to always bear in mind that not everything is just long COVID. Long COVID is intertwined into all these comorbidities as well. And you have to really sift through that to find where you are.
Doctor, let's wrap up with benefits. What benefits could a consumer typically experience on their cognitive health while on NAD plus supplements?
So I think the most important thing with the NAD supplement, once we've added in all the treatments for comorbidities, what do we see? Because I see a lot of these patients, and what is the progression? I think the first thing that we see is that the patients start to improve on their sleep. The first thing is the amount of sleep, how long they sleep. Or the second thing is the quality of sleep. They start to dream and have really relaxing sleep, which they haven't had. Followed by that, a reduction in anxiety. Anxiety is a major part of long COVID. And then after that, when I'm dealing with them, I'm dealing with these people that are sleep deprived initially, severely anxious. But the improvement, you start to see an improvement in their thought process. They become more ordered in their thought function. They have better focus, concentration, and slowly over time, improved memory and decreasing of the brain fog that we hear so much about. And then while we're doing all of this, we also need to be managing, as I said again, the risk factors: nutrition, infection, vascular problems, cholesterol. That needs to be part of part of the management of the cognitive function as such.
Thank you so much, Dr. Wentzel, for your time once again. Remember, if you're watching these, like, subscribe, give us the thumbs up button, and share them with friends and family. They are brought to you in partnership with Cipla. And this episode brought to you by CertMune. Subscribe, and we'll be back again with another episode of Health Matters.